get way over here.
Okay, yeah, thank you, sir.
All right.
Yeah. This way.
Are we good to go? Great. Okay, can you hear my voice? Is that a good projection? Okay, a little louder? Okay. Good morning, everyone. Thank you for coming out on this stunning morning. My name is Sarah Vogel. I'm the Senior Vice President for Healthy Communities at the Environmental Defense Fund Action, which is the advocacy partner for Environmental Defense Fund. And on behalf of a number of organizations that have co-sponsored the event today, and I'd like to list those all: the Alliance of Nurses for Healthy Environment, Earth Justice Action, Elected Officials to Protect America Code Blue, Environmental Working Group, the Learning Disabilities Association, Moms Clean Air Force, the National Center for Healthy Housing, NRDC Action Fund, Toxic Free Future, and Safer States. We want to thank you for joining us for an urgent conversation on the state of our country's main chemical safety law, the Toxic Substances Control Act, or TSCA. No, I really have to project. I'm just going to wait 1 second. Toxic chemicals have upended the lives of far too many Americans. The train derailment in East Palestine 3 years ago, tank explosions that have released toxic fumes into nearby communities, and from communities from Texas to Arizona to Maine to New York to Ohio to Indiana, who are experiencing dangerous levels of chemicals in their drinking water and in their air. These incidents are not isolated. They are reflections of failures of our effort to effectively manage toxic chemicals with real-world serious consequences for families, workers, and communities, from the loss of health, the loss of livelihoods, of property, of homes, and the loss of the lives of loved ones. Today, we're going to hear from veterans, former elected officials, healthcare providers, and families whose lives have been upended by toxic chemicals. Their stories are a powerful testimony of this urgent need for strong protection from toxic chemicals, and they demonstrate why the Toxic Substances Control Act is one of the most vital public health protections we have in this country. But today, those protections and the integrity of the law itself are at risk. So despite overwhelming bipartisan support from Americans for stronger safeguards and more oversight by the government, and despite well-documented and mounting evidence of the health harms from chemicals like PFAS, TCE, and formaldehyde, despite all of that, there are legislative proposals in both the House and the Senate, heavily influenced by the chemical industry, that would fundamentally undermine this law's ability to protect the public's health, especially those who are most vulnerable. And this comes at a time when this administration's EPA is rolling back just common sense environmental health protections. So that's why we're here today, to stand firmly to protect this law. We'd like to thank Congressman Paul Tonko for joining us and being a steadfast leader on this effort for so many years. He's an 8-term member of the U.S. House of Representatives and represents New York's 20th District. I'm going to turn it over to the representative for some framing remarks, and then I'll come back and introduce our speakers.
Thank you,
Congressman.
Sarah. Thank you, Sarah. Good morning, everyone. Good morning. It is so great to have EDF Action, all of the organizations that were mentioned by Sarah Vogel in her introductory comments, to have everybody here to speak boldly, because we have an administration right now and members of Congress who believe it's good to be there for special interests. Well, all the voices that are raised here today and the many across our nation that are part of their spirit are about making certain the air we breathe, the water we drink are clean. And we need to make certain that we do everything we can within our policy initiatives and our resource advocacy to make that difference. Thank you to all the advocates that came here today to make the effort to be here, to join in a chorus of support for a strong TSCA and TSCA implementation. You know, I was there when folks said the 1976 bill had to be updated, made stronger, more accountable. and I worked with then Representative John Shimkus to work steadfastly at coming up with an improved TSCA bill. And it is really dreadful that it is not being implemented as aggressively and as holistically as possible. We know that chemical exposures can cause cancers, can cause neurological diseases, and many other health harms. Americans deserve, they require a chemical safety program that will keep dangerous new chemicals out of commerce and restrict existing chemicals that are determined to be unsafe. Now that's a passionate agenda, but it's one that's science-based and it's one that ought to be adhered to. 10 years ago, when I was part of that effort to reform TSCA, everyone agreed that TSCA was not working. Congress enacted the Lautenberg Act, and while I felt this law didn't go far enough, it was indeed intended to be an improvement over the previous status quo. Now, some decade later, EPA has only been able to finalize a handful of risk management rules, which are still subject to ongoing litigation. I don't want to be dismissive of EPA's important work to ban asbestos and TEC, but I do not believe anyone can reasonably look at EPA's track record over the past decade and reach the conclusion that that agency has been too aggressive at regulating chemicals. You just simply can't prove that. And yet there are serious efforts underway that would fundamentally weaken EPA's ability to protect people from chemical exposure. Now, we're a smart society. We grow smarter with the American intellect. It is important for us to impose upon an industry in a way that enables them to function, but to be sensitive to the needs of the American public. These proposals would make it harder for EPA to test, evaluate, and restrict new and existing chemicals. And they would gut protections for workers. We're going to hear some of those testimonies today. We have seen other attempts by the Trump EPA to weaken scientific integrity, diminish scientific evidence, and eliminate industry reporting requirements. I believe these changes are part of this EPA strategy to make it harder for future administrations to pursue science-based public health protections. I have joined with so many who speak in defense of the environment in protest in front of the agency because they want to roll back progress, and we're not about rolling back. We're about going upward and onward with protections for the American people. We deserve an EPA that works for the American people, not corporate interests. And that means a chemical safety program that upholds the agency's responsibility to protect human health and, yes, our environment, our shared environment. Thank you again to everyone who has come to D.C. to continue this fight. I will continue to stand with you against any efforts to weaken and reopen TSCA to put industry profits over the public interest. We can do it. We can get this done. There are many passionate souls that are ready to carry on the fight. Let's make our environment stronger. Let's be proud of the legacy we helped build. Thank you, one and all.
Thank you so much. Thank you so much, Congressman. I am honored to introduce 4 individuals among well over a dozen who've come to Washington to share their personal stories of how their lives have been upended by toxic chemicals. Carrie Reinhardt is a community advocate and co-founder of If It Was Your Child, formed in response to a devastating pediatric cancer cluster in Johnson County, Indiana. Carrie.
Good morning. My name's Carrie Reinhardt, and I'm from Franklin, Indiana. I lost my daughter, Emma, in 2014. She was 13 years old. Emma had a brain tumor, the kind that doctors usually see in 50-year-old men. 3 months after her diagnosis, Emma died in my arms. After she died, I started to learn a lot of things that I really wish I had known when she was still alive. That for years our community had been exposed to TCE, a known carcinogen, through contaminated groundwater, through vapor coming up through our homes, our sewer lines, running through our creeks, coming up through the slabs in our children's schools, our businesses, the soil. Everywhere I took my children, they were exposed to poison. We found it as far as 1.5 miles from the contamination plume, and levels higher than a commercial dry cleaning limits were allowed to have. We were surrounded by it, and no one told us. Franklin has 17% of Johnson County's pediatric population, yet it had 46% of the county's pediatric cancer cases over the span of just 10 years. Most of those kids lived within 1.5 miles of the site. And I think about that a lot. Like, what if we had known sooner? What if regulations that had existed, which were already there, were actually enforced? What if the law had required action earlier than the decades and decades later? I can't answer those questions, but I can tell you that Emma didn't have to die without us knowing why. In 2024, the EPA finally banned TC under TSCA, and that ban exists because of the 2016 Lautenberg reforms, bipartisan legislation giving the EPA the authority to act. It took 10 years to get there. 10 years of me coming to Washington, bearing my soul, telling them a story, asking people in the building to do something. The science has always been there, and the EPA themselves have even stated that a single exposure to TCE, even a short-term exposure, is harmful to human health. Why would we possibly consider lifting that ban? I want you to know that there are real lives at stake here. There are Franklins all over the country right now and families who don't know what I know. Every Franklin that comes after this one today, every single one, every child, is a choice to put special interest ahead of our children. You cannot bring Emma back, but you can protect those families, and you can make sure that the next Franklin does not happen. Thank you.
Thank you so much, Carrie. Next, we'll hear from Dr. Pat Spearman, a decorated U.S. Army veteran, former Nevada state senator, a reverend, and a longtime environmental justice advocate.
Good morning. As you've heard, I am an ordained minister. I am a veteran. And I'm also someone who is suffering severely from asthma. When I was stationed at the Pentagon back in the early 2000s, it wasn't 9/11, but everybody remembers that. That's the day that will ever be embedded in our mind. When I was stationed back at the Pentagon, when they started to do the renovation, the Pentagon was built at a time when asbestos was the product that they used for insulation. Now, we didn't know that, but my team and I walked through dust that was thick enough to hide our hands in front of our face. Everyone on that team wound up with respiratory illnesses. Every one of us. And some of them, I've heard, paid the ultimate sacrifice with their life. When we think about what is happening on our earth today, when we think about what's happening when people trying to roll back protections that they know are harmful to human beings, why in God's name would we stand for that? I want to speak to those who think it's okay to send people in the military into harm's way. We go where we're told to go, and we do what we're told to do, as long as it's a legal order. But when we do that, we expect the country that we're serving, we expect the people who are in Congress, we expect the people who are supposed to be protecting our healthy interests, we expect them to do our job, to do their job. That did not happen for me. That did not happen for me. I've been to emergency rooms a lot of times. I mean, in the last 2 weeks, I was there having to receive emergency breathing treatments because my lungs were failing. When I go to the emergency room, I see children there, and they're gasping for breath, just trying to live. When I was their age, I was running around, jumping and climbing trees and all, and those children are stuck in the house. Why? Why? Because we haven't done our job. And now they want to roll back protections, and I say, in God's name, why would you do that? What if it were your child? What if it were your grandchild? What if it were your son or daughter who had served in the military and now has issues with breathing? I say here today, right now, we cannot go backwards. No, let me rephrase that. We will not go backwards.
Right.
We will not go backwards.
Okay.
And we will not go backwards because we have children depending on us to go forward. We will not go backwards because we have our grandparents depending upon us to go forward. We will not go backwards because we have veterans depending upon us to go forward. And so I say to you today, no backwards looking, but in the name of God and all that is good, let's move forward, strengthen the regulations, don't weaken them. We will either do that now or our children will pay for it tomorrow. Thank you.
Amen.
I feel I must say amen. Thank you. Thank you, Reverend. That was very moving. Next, we'll hear from Craig Miner, who's a retired Air Force Lieutenant Colonel, a former B-52 aircraft commander, a chemist, a law graduate, and who spent 21 years stationed at Wordsworth Air Force Base in Michigan. Craig.
Well, good morning, everyone. As a 21-year Air Force veteran, 43-year husband to my beautiful wife, Carrie, and 42-year dad, and 19-year grandfather of 10, I stand here to tell you a true story that should have never happened. From 1986 to 1990, my brand new family lived and worked at the former Wordsworth Air Force Base in Michigan, where I flew B-52 bombers. During that time, our family, along with everyone else on base, drank, cooked, and showered in water contaminated by colorless, odorless, and tasteless PFAS from firefighter foam. Government records show foam waste was dumped on the ground just 500 yards upstream from the base's main drinking water wells. Official records show levels reached 43,000 parts per trillion of PFAS at the dump site, over 10,000 times higher than what is safe to drink today, of only 4 parts per trillion. This foam, 3M's light water, was invented by the U.S. Navy with the help of 3M, then sold by 3M, distributed by the Department of Defense, and released by the Air Force over the entire Wordsworth landscape for 23 years, from 1970 to 1997. The same thing happened at nearly every military installation worldwide and at many more civilian locations. Our family's story is just one of hundreds of thousands of families poisoned by the specific PFAS in 3M's light water. PFAS was first measured in the Wordsworth groundwater in 1998 as part of a doctoral study partially funded by the EPA. In 2002, 3M stopped making light water because of health risks. In 2008, the Michigan Department of Environmental Quality confirmed base-wide groundwater PFAS contamination and found high levels of PFAS in abandoned fire hydrants and old water heaters from the base when it was operational. Wordsworth closed in 1993. In 2019, my blood tested 17 times higher than the national average for PFAS, especially PFXS, a signature chemical of 3M's light water. To ignore the facts that veterans, civilians, and their families living and working at Wordsworth were poisoned by PFAS is nothing more than willful ignorance. On behalf of my family and all the veterans and their families, here is our PFAS poisoning testimony from what happened on federal land. In the fall of 1989, our son Mitchell was born at Wordsworth with microcephaly, small brain, infantile cerebral palsy, spastic quadriplegic cerebral palsy, scoliosis associated with his condition, generalized convulsive epilepsy with intractable epilepsy, Lennox-Gastaut syndrome, and respiratory insufficiency. Mitchell required round-the-clock care. At first, a doctor said Mitchell would not live past 5. When he was 6 years old, doctors suggested he would not live to be a teenager. After Mitchell's 13th birthday, doctors stopped guessing. Mitchell was tube-fed and lived in a hospital bed at our home for 30 years until he passed away in 2020. His profound handicaps were consistent with severe environmental poisoning. By the way, he was a daddy's boy. My own health struggles also began at Wordsworth. while Mitchell was still in the womb, I was hospitalized with a mysterious prostate issue at age 20 and had a large tumor removed from my back. Today, I live with an enlarged liver, an enlarged spleen, an enlarged prostate, poorly functioning kidneys, neuropathy with no history of diabetes, and serious heart disease, quadruple bypass surgery, and tandem stents placed in my widowmaker artery. My cardiologists say I have the heart of an 80-year-old. All my issues, and not all listed here, are consistent with PFAS epidemiological studies. We chronicled our family's journey with Mitchell in our book called Overwhelmed, the Civilian Casualty of Cold War Poisoning. You can find our book, ebook, audiobook, and paperback on Amazon. You can join our lives by reading that story. Also check out Sarah Gannon's February 2020 documentary, No Defense, and Megan Thompson's November 2024 PFAS NewsHour story, how toxic water in northern Michigan is affecting military veterans and their families. PFAS poisoning was not unique to Wurtsmith. In 2015, the DoD tested drinking water at other military installations and found PFAS, some in the thousands of parts per trillion. In 2022, the National Academy of Sciences published a major report detailing the serious health effects of these chemicals. In 2024, study veteran blood serum samples from the DoD's serum repository, drawn in the 1990s, tested well above the 1990 national averages for PFAS at that time, especially PF-HEX-S. Yet today, the DoD still refuses to acknowledge the health harms to veterans, their spouses, their children, including those in the womb, civilians working on base, and surrounding communities. That is why the health protections of the Toxic Substance Control Act are so important. But today, crafty wording in draft bills vowed that would weaken the law, returning us to a time when the new PFAS flooded the marketplace. Congress must also immediately establish presumptive conditions for veterans exposed to PFAS and other toxic chemicals at bases like Wurtsmith, so that we can have the proper access to care they need now without the heavy paperwork burden, before these prolonged exposures and deadly chemicals erase the need for action. Thank you, and God bless.
Thank you.
And finally, we'll hear from Jess Conard, who is a community leader from East Palestine, Ohio, and the founder of Rail Watch, an organization dedicated to preventing train derailments. Jess?
Hi, everyone. My name is Jess Conard, and I am from East Palestine, Ohio. At the time of the derailment, I lived in a house next to a horse farm and a pond. It was on a street named after my family, but it wasn't just a house. It was my dream home. My husband and I had moved 14 times prior to buying that home. In March 2022, a year prior to the derailment, we finally had stable jobs. Our plans, our dreams, everything felt like it was coming true. We lived there for 11 months before the derailment happened, and the derailment changed everything. The train was on fire when it passed by my home. Many of my community members were forced to evacuate in the middle of the night with their children and their pets. My home was 2 miles away from the derailment site, and we were advised to shelter in place. We could smell the chemicals, but everyone said that the smells were not toxic. We know that wasn't true. A few days after the derailment, we were also told that the vinyl chloride was going to explode, and if they didn't release and burn it. That was according to the investigating agencies. The NTSB said later that the train derailment was preventable, and the vent and burn, the release of 115,000 gallons of vinyl chloride into a soil ditch in our protected waterways, none of that was necessary. The CDC held a town hall a few weeks after the derailment and told us that we had indeed been exposed to dangerous carcinogenic chemicals. There was nothing they could do about our exposures, but not to worry because they could treat our cancers. In the months following the derailment, many kids in the community suffered from nosebleeds, headaches, eye irritation, and skin issues. My son now has asthma. My co-parent has permanent retinal damage in his eye. When I found out about the Toxic Substance Control Act, I felt relief. I quickly jumped into the campaign working to ban vinyl chloride the summer after the derailment. I presented a petition of 30,000 signatures to the EPA on the front lawn in Washington, D.C. I think it was the hottest day of the entire year. Later that year, the EPA responded and selected vinyl chloride as one of the 5 new chemicals that would undergo a risk assessment and rulemaking process. It felt like a way we could catalyze this crisis in my community and maybe prevent other communities from experiencing what we had experienced. We talk a lot about the health issues, the environmental issues, but we don't talk about the displaced emotional geography. I was married for 17 years and now I'm divorced, estranged from many members of my family. I live in a new home, a new city. My career changed. Nothing about my life is the same, and I've been forced to rebuild. The phrase that resonates with me is that the train derailment was preventable. The vent and burn was not necessary. With TSCA, we can protect communities. We can prevent all of that. To make rules that benefit public interest instead of corporate profits. We currently live in a society where profits are privatized while risk is socialized. And that is no longer a framework in which we should be living and no longer a framework that I will accept. Every time I hear my son struggling to breathe, I think about how these disasters continue to happen over and over and over again. With TSCA, we have an opportunity to make unbiased decisions that support humans and the planet. With TSCA, we can prevent chemical disasters before they happen, because they are happening now. And without it, we have nothing. I traveled here this week from Ohio to ask Congress to protect the law that protects us. I'm asking Congress, will you do that? Will Congress protect the bipartisan law that protects your family and my family from the chemicals? Please do not defund the EPA's Chemical Safety Division. Please do not bow to industry pressure to stall critical safety reviews. Let's keep TSCA intact.
Thank you so much. Thank you all for those incredibly powerful stories. I think the message is clear that we refuse to give up on the modest progress that we're making for communities across the country. Thank you again, Congressman Tonko, for all your leadership. This concludes the formal part of the presentation. We have subject matter experts and our community leaders here available for questions. And if you want an interview, we've got staff here to help facilitate that. Thank you very much for your attention, and thank you to all of our partners. Woo! Thank you. Thank you so much. Yeah.
We should get a group shot.
So let's get a group shot.
It's a blessing to be able to tell.
Sarah, before everybody leaves, can we get a group shot?
Photo, yes.
We're going to get a group shot.
You want us over right there or behind the podium?
Actually, I think if we can slide over just a little bit, just right over the podium here.
Yeah, so you know.
We're gonna slide
Way
that
over?
way.
He said step to the left a little bit. He was trying to get the
All right, just tell me when to stop.
whenever he starts.